Why do we need rural health workers? Did you know that almost half of the world population lives in rural areas? This includes populations that live near rivers, in forests, deserts, islands, mountainous regions, and other remote areas.
8 out of 10 people living in extreme poverty live in a rural area. More than half of the people living in these areas are without adequate access to essential health services.
Yet, rural health and access to health services are often neglected in analyses of health status and health system performance. Universal health coverage cannot be achieved without a well-trained, motivated and supported rural health workforce.
Addressing the maldistribution of health workers in countries is key to addressing the pervasive inequity in access to health services in rural areas.
So, what can be done?
Within a primary healthcare approach, health workforce policies and strategies play an important role in not only ensuring better health outcomes, but also in driving community engagement, gender equality, and sustainable economic development.
There is a clear need for a whole-of-society approach to develop, attract, recruit, and retain health workers in rural and remote areas.
We must invest in development and training of multidisciplinary fit-for-purpose rural health teams.
Enrolling students with a rural background in health workers' education programs, bringing students in health worker education programs to rural and remote communities, having health education facilities located in rural areas, and aligning their education with rural health needs.
We must protect and support the existing rural health workforce by giving them decent conditions to live and work, with access to continuing education, professional development, and attractive career pathways.
It is also important to recognize the contribution of this workforce. To guarantee and ensure healthy lives and promote well-being for all at all ages, we need to have policies to develop, attract, recruit and retain health workers adapted to the unique realities of rural and remote areas.
The newly updated WHO guideline on health workforce development, attraction, recruitment, and retention in rural and remote areas offers a broad view of what can be done to achieve the global principle behind the 2030 Sustainable Development Agenda and to leave no one behind.
So let's think and act in rural areas
Together.